Welcome, everyone. Sorry, I was on mute. um, Thanks for coming today. This is the Health Literacy Solution Center webinar. It's about health literacy and patient outcomes. And I think we'll get started. I think most people are in. So hello, thanks for being here. My name is Julie McKinney. I am the moderator of the Maine Health Literacy Community, which is the listserv for the Health Literacy Solution Center. And I'd like to welcome our speaker, Jessica Daly. Today, she's going to talk to us about health literacy and patient outcomes. I know it's something that in this community it's always sort of the gold standard to actually get to patient outcomes. So we're really happy to have her here. I'm just going to go over quickly some housekeeping stuff, and then we will get started. Let's see. Okay, so you're all on mute. That's how these webinars go. But please, feel free to comment or introduce yourself in the chat. But if you have questions for Jessica at the end, please put them in the Q&A tab at the bottom. That makes it a little easier for us to manage the questions. So questions in Q&A, anything you want in the chat. If you have technical difficulties, then I will put this in the chat, but there's the email there for how to get help. Hang on a second. I'm just going to put this in here. And then if let's see, I think that's it. Oh, one more thing. This will be recorded, so don't feel like and you'll have the slides and the recording, so don't feel like you have to copy everything, and you'll be able to see that on the webinar page on the Solution Center website probably next week. If you want CE credits, you'll get a evaluation emailed to you, and once you fill that out and submit it, then your credits will be emailed to you. So that should be all set. And I'm putting all of this in the chat just so you have it. But next, I would like to get going and tell you a little bit about Jessica. Jessica Daly, who has lots of letters after her name, as you'll see. She's currently the head of collections and electronic resources and head of library outreach and marketing for the R.A. Williams Library. And this is at Advent Health University in Orlando, Florida. As a faculty librarian, Jessica holds the ranking of assistant professor. She got a Bachelor of Science in Education and a Master of Library Science from East Carolina University. Jessica is a published author, columnist, and public speaker. She was named Hospital Librarian of the Year for 2020 by the Southern Chapter of the Medical Library of Medicine and was awarded exemplary instructional programs or services in 22 by the Florida Library Association. We love having librarians on the list, as many of you know. Jessica has been married to her best friend Brian for 24 years and is the proud mother of a 20-year-old daughter, Taylor, who is at Seminole State College. She also has two dogs, Bella, a Shih Tzu mix, and Scout, a golden retriever, who I'm told has been put away so as not to disturb the webinar. So Jessica, we're really happy to have you. Welcome, and you can take it away.
All right. Thank you so much, Julie. And yes, Scout is in his house or bedroom for just a little bit because he loves the camera. So we are going to talk today about low health literacy or health literacy connected to patient outcomes. So the very first thing I want us to address is what low health literacy is. And our formal definition is the inability to understand and use health information to make informed decisions and manage one's health. So really what this means, and as I share with patients, with medical providers, with whoever I'm speaking to about health literacy, it really breaks down to, do you understand your health? All aspects of your health. And for most people, the answer is no. And so we're going to look at the connection between low health literacy today and patient outcomes. So, we librarians have to start out with some statistics, some research. Medical research is what I do. And so I want you to take a look at a few of these numbers. So we know that around 36% of adult Americans only have basic or below basic health literacy skills. So the average person that you would ask very detailed questions about their health probably couldn't respond with the correct answers, or they would say they did not know. And only 12% of Americans are actually considered proficient, or what we would call a health literate patient. But there are things that have to do with this, and we're going to look at a lot of those today in connection with patient outcomes. But certain demographic groups or subgroups are at greater risk with low health literacy. And we see this often with people with lower educational attainment. So maybe they did not finish high school, maybe there are learning disabilities or things there that inhibit them from learning more. We also see this with the elderly. And, I can say as a person with parents that are in their late 70s that this has been a challenge. Me helping guide them through the medical world, the journey, their health, how to interact with their physicians, with their healthcare teams, with insurance, is very overwhelming. And then we also see underserved minority groups as having higher risk of having low health literacy and not understanding their health. And then for many groups or areas or cities, especially like the one I am blessed to live in, Orlando, Florida, which I love, I call this a melting pot. I have friends and colleagues and neighbors from all over the globe. This is just a place where people from all over the world have come to live, which is an amazing thing. But we also see a large group of immigrant population here in the state of Florida, and they're coming and do not understand English, or that is not even their second language. And then we also deal with cultures and how medicine and medical care was in the country they come from. So there's a lot of issues there that need to be addressed when we talk about immigrants. And then also, here's just kind of a basic number for you. Among Latinos, 66% of them have basic or low basic health literacy skills. So, this is something that we have to acknowledge and talk about before we even get into those connections with patient outcomes. So, how does improving health literacy help people? Well, these are the major areas. So, we don't have time to dive into every one of these, but I do want to acknowledge each of these. The first is just finding the right services and doctors. In my years working for a healthcare organization and being a consumer health librarian, which meant that I was a medical research librarian for patients and their families and even the community, I saw this as a huge stumbling block for people. They didn't know where to go, how to connect with a physician, how to get the care they needed. Next, we see people managing chronic health conditions. And let me just be transparent here and say that my husband, Brian, he was diagnosed 17 years ago with congestive heart failure. And that's a chronic condition. And I call it the roller coaster. Sometimes we're doing really well. Other times it is a struggle. You're in and out of the hospital. You have to learn how to maneuver the healthcare system because it's not a one time thing, it's a lifetime with chronic illness. And so, managing that, we have kind of a not really a joke, but we do joke about it to make light of it. It's always better to laugh than cry. But when he became sick, I said that caring and managing his health care became a second job to me. It is very intensive, and there's so much to learn and so much to understand. Then getting to where people need health care, to their appointments, to the hospital, getting to where they need to go. So many of us take for granted that we have a vehicle, that we have a way to get to and from our appointments. And so often people don't. Taking medicine the right way. I do complete webinars and sessions on managing your medications. That is very difficult. And knowing why you take something, when to take it, how often, how much has everything to do with your outcomes. And then filling out health forms and accessing health information online. That can be most difficult for people. And then being able to share your medical history. If you know your medical history, that's wonderful. If you don't, that really could be a stumbling block. I think about a dear friend of mine from high school and college. She was adopted and did not have any medical information from her biological parents. So that was often very just kind of frustrating for her when she would go to appointments and they would say, is there history of this, and she'd say, I don't know. So that can be difficult. The other things here is just how to follow the advice that you've been given after, how that looks after an appointment. So all of these things go together. So, what are patient outcomes? So, with working in a hospital system for many years and now working for a health science university, getting people ready to be healthcare professionals, health outcomes, patient outcomes is key. And this is so important. This is why we do what we do in the medical community is to gain positive and good patient outcomes. So, what does this look like? So, what this looks like is, oh, sorry about that. We have gone ahead. I didn't mean to do that. So, what this looks like is patient health status or their quality of life. We want people to have the best quality of life possible. This has to do with the patient, the provider, and population attitudes and behaviors toward medical care. And then new evidence, research, preventative strategies, all of these are so key and important. So let's break this down a little bit today. Let's take a closer look. So, patients with low health literacy or low understanding of their own personal health struggle in these four areas, and we're going to look at them today. Number one is patient safety, two is health behaviors, three is health status, and four is healthcare utilization and costs. So let's start with patient safety because that is always the top number one priority in a healthcare system. We want patients' safety to be number one. But here is what happens when patients come in with low understanding of their health or healthcare. Number one is they have real trouble with instructions. Now, one of the things that I really encourage with healthcare providers when I work with them and train with them on health literacy is making sure that your patients can access information in different formats. So let me give you some examples. Number one, we often, I think it's 80% of what is given to patients as far as instructions or follow-up information is written. And in the United States, most of that is in English. So, what we're seeing is that number one, we have to offer this information written in their native language, whatever that might be. And then number two, we need to look at different ways of giving them that information. So, I often would give patients written information, sometimes audio, video, graphics, pictures. So it's really making sure that we give this information and that patients ask for this information in a format that will best suit them. The next thing we talk about is medication use. So often we see low or unsatisfactory patient outcomes because of medication errors. And often this is on the patient's side of things. Now, there's a couple things here that I want to address. With medication use, it is just as important for you as a patient to connect with your physician about your medications, but also your pharmacist. I worked with several pharmacists when I worked with the healthcare system as a consumer health librarian. And the number one thing they said was, Jessica, please encourage patients to talk to us. Please encourage patients to set up a consultation with us, call us on the phone. A lot of pharmacists will even do video chat meetings with patients if you're unable to come in person. And so it's so important for you to understand not only the medications that you're taking, but why you're taking these medications, what side effects to expect, what could or could not go wrong. So, an example I give here is often our ER nurses would tell me that patients that had just started taking blood pressure medication for hypertension would come into the ER terrified. And then when they would explain how they were feeling, it was actually very common side effects. So, had that patient known, they may not have been as fearful and may not have gone into the ER for something like that. So the next one is follow up appointments. And let me just say that this is a topic that I really want to enforce with you, but I want you to understand that patients have to be their advocate when it comes to this. This is another area I've had to walk my parents through. So, for instance, my husband had a hospital visit a couple years ago. So, knock on wood, we're very excited that we did not have one in 2022 or 2023. Gosh, we're going into 24. And so, our last hospital visit, of course, when we left, our instructions were to follow up with his cardiologist within 2 weeks after getting discharged from the hospital. Well, we waited a few days. They said they'd set that up. We never heard anything. So after a couple of days, I called the cardiologist. They did not know that he had been hospitalized and they did not know that he needed a follow up. And when I called for the follow up, they told me that it would be at least a month and a half before we could come in. So let me just be the first to tell you that it can be very frustrating to schedule follow up appointments, but they are very important. And even if you don't do a follow up appointment, I encourage patients to at least call their primary physician or any physician that would need to know that they were hospitalized and what took place during that visit. Thankfully, now a lot of healthcare systems are going on the same computer system so that those records and those things are, accessible by your physicians and not only those in the hospital. But it is important to make those follow-up appointments. And often we see with patients with low health literacy, they don't see a need in that. They are better, they're out of the hospital, and so that is an area that if those follow ups happen, we see greater or increased patient outcomes. So, health behaviors with low health literacy patients, we're less likely to see them engage in these three things. And number one is preventative services. So, often I see most patients discover that they have a diagnosis after it is very advanced. And that's what we want to avoid. And as I told patients for years and still tell people, for instance, let me use the example of a mammogram. So I have a mammogram every year, whether that's required or suggested or not, because my mother is a breast cancer survivor, was a cancer patient. And because of that, I want to make sure that if at any time I develop cancer, I take charge of that and I find out very early on. And let me just say that she discovered her breast cancer through a mammogram. Self exam would never have found her lump and or her cyst tumor. And so, what I want you to be aware of is preventative services actually help increase patient outcomes because you catch things early on, and that's so important. Cancer screenings, I just mentioned, both for men and women. This is something that is not in required. It's something that you need to be proactive about, but it is something that is very important. And then adopting healthy lifestyles. We see often a correlation, a direct connection with low health literacy and poor diets and health habits because these patients don't have the information. They don't see the importance. They haven't been taught why it's so important for us to have a healthy lifestyle. So, because of these three things, we often see patient outcomes that we don't want. We don't see good patient outcomes. We want these three things to be going on, and we see that when they happen, patients do have those positive outcomes. So, our health status, what do we often see in patients with low health literacy? Number one is poor physical health, or there are things going on with their health that they put off, they ignore. And again, then we see these patients going into the ER at very late stages. Had they gone in earlier, had they been checked, much could have been avoided. While I was working in the library as a consumer health librarian, I will never forget the afternoon that a young woman came in, 23 years old, and she asked me if I could help her gather information on colon cancer. And so I quickly obliged, told her I'd be happy to. In my mind, I'm thinking, a parent, a grandparent, she's being very kind and looking up information for them. And as I was gathering the information, she began to cry. And of course, I stopped and asked her, how could I help her? And she said, I'm the patient. And I said, oh my goodness. And she said, yes, I have stage 4 colon cancer. I knew about a year ago that something was wrong, but I was too afraid to go to the doctor. And she said, now I have stage 4 and I don't know if they can save me. And so I share this story with you because it's very real and I see this so often. So it is important when we have aches, pains. We know our bodies. We know when we feel different. We know when something's off. And that is so important for us to go and be checked, see our physician. And then the next thing we see is poor mental health. We see an increase with those of low health literacy with depression and anxiety, mental health issues that are not being addressed, not being treated. And this again leads to poor patient outcomes. Then we have healthcare utilization and costs. So I want you to understand that low health literacy increases healthcare costs directly. And this is something for the patient to understand, but also for the hospitals and our facilities to understand. We see higher hospitalization readmission rates with those having poor health literacy or low health literacy. Often needed, but often unneeded visits, frequent use of emergency services. So, because they do not understand their health or they don't understand symptoms or side effects, they often go to emergency services for assistance because they are fearful. And then we see higher costs because, just the ambulance service, going into the ER, any hospitalization, physicians, um, costs, all of that is just very much increased with people of or patients that have low health literacy. The other thing here is if a facility, a hospital, a physician's office invests time and money into increasing, improving their patients' health literacy, we will then see a decrease in their costs as a facility. So it is very important on both sides for health literacy to be improved so that costs are decreased. So, whose responsibility is it? Who is responsible for patient outcomes? So, number one are the decision makers for hospitals or medical practices. So, these are our administrators, our leadership, the people that make the decisions. So, it is very important for them to not only desire improve patient outcomes, but understand that improving health literacy will improve patient outcomes. So we see also that health literacy, having consumer health librarians, librarians that work with patients, that is not a requirement of healthcare facilities in the United States. So this is something that they have to see as important and they have to invest time and resources into in order to reap those benefits. Physicians are very integral in patient outcome, and all support medical professionals. So, everyone that works within a healthcare facility of any type, any size, is responsible for patient outcomes. So, I always say that goes from the receptionist that checks you in, through every healthcare worker that you come in contact with, and then also through your discharge process. Um, Everyone is responsible for helping patients have their greatest patient outcomes possible. And then we also go to team leaders. So we see this not only on the clinical or medical side, but also on the administrative or office side. So leaders in these areas hold a great responsibility for patient outcomes. They should be in touch with what is happening on the clinical and the administrative side of the patient experience, and making that as easy and as seamless as possible is going to improve patient outcomes. And then the last one is actually patients themselves. And that is something that we're going to dive into a little bit as well. But we, as patients, or the patients we serve, are responsible for their own outcomes. So the first one is quality of care. Healthcare administration is responsible for this, healthcare professionals, and also our medical support staff. So this is making sure our patients are safe. We want to reduce the number of readmissions. So having plans of sending patients home informed, and understanding how to self care once they leave the facility is key to readmission. And then effectiveness. We want to make sure that we are achieving the desired outcomes for a patient's health. We want to make sure that they have the best practices and best knowledge, again, in a format they can understand before they go home. But then that creates that effectiveness of the treatment or the procedure they had done, or the medication that they're taking. And then equity. We want to make sure that we're delivering constant levels of care, regardless of gender, race, geographical location, or even socioeconomic status. We want every patient to receive the same care. Then we go into operational efficiencies. We want our healthcare facility to function well and efficiently, and this has so much to do with patient outcomes. So let me just say that if a patient has a poor experience at any healthcare facility, they are less likely to return, and more than likely never will return. So that could be what hinders them healing or their best outcomes. So we want to make sure that we address a few things, and this goes into administration and also our healthcare professionals. Number one is shorter wait times for patients. I have to say, as a patient, as a health care recipient or consumer, and also as a caregiver for my family and my husband especially, wait times matter. I would rather have, an appointment a few days later and not have to wait hours. And that is very difficult. So, that is definitely a challenge on the end of the healthcare providers and administrators. Cheaper costs for patients. So, finding ways to help patients save money. And this could be through, maybe a telehealth. Meeting instead of having them have to come in physically. It could be being able to communicate with your physician through email, or an online um, chat type service that is through the hospital or the medical portal, the online, and also reducing unneeded tests. So, making sure that everything that is ordered is needed, and not just, making decisions without keeping that in mind. And then having efficient admittance and discharge. So, that could be in the hospital, but also just you're in and out of a healthcare facility, making sure that that is an easy, seamless process. And let me say, one of the ways here that I think is great now, and I tell patients to take advantage of, is that once you get an appointment with a physician, or even before a hospitalization that you know is is upcoming, you can actually download, print out the forms, and have those completed before you go into an appointment or for a procedure. And what that does, it is allows you to take your time, look up needed information, and then also have that ready to hand to them as soon as you arrive at your healthcare facility. And then the last is patient satisfaction. And I don't know about you, but working in healthcare facilities and now even in a health sciences university, we always look and focus on patient satisfaction because that's when we have patients return to us when they need care in the future. And we also see that that is when patients will recommend their healthcare provider to others. And that is so important as well. And so let's take a look at a couple of these things. This is the administration, the healthcare professionals, your medical support staff, and patients all have a responsibility in this area. So, level of satisfaction with care. So, this goes in lots of different avenues that we won't get into today fully, but this goes from how seamless the process was, how patients were spoken to, how they were comforted, the bedside manner, not just the clinical care, but the whole package. And that's what we're really focusing on today. Also, feelings about the online platform. So it's amazing to have this technology now that you can access right from your phone or your computer all of your records, your appointments, message with your physicians, see your medications. That's wonderful if you know how to use these applications. And so it's very important for us to make sure that patients understand how to use these online platforms or these apps that hospitals and healthcare facilities have adopted and are now using. So that really is key. If people can utilize that, it does make their healthcare journey so much easier. And also, I mentioned a little earlier, but your clinical treatment, how you are treated in the facility. How does the doctor communicate with you? And that goes into clear communication. And we're going to address that a little bit as well before we finish today. And then appointment scheduling. I talked about that earlier. It really can be difficult. But now on some of these online platforms, you can book appointments. For instance, Advent Health is my healthcare provider. They're also the the connection and the owners of our university. So I use Advent Health. And so it is time for me in the next month or so to have a mammogram. We spoke about that earlier. And so I just went on my Advent Health app, put in that I needed an appointment. It walked me through the process, and I scheduled my upcoming mammogram for next month without ever having to talk with anybody, be on hold, go to a facility. It was very, very easy. So it makes me more apt to schedule those appointments. So if scheduling is something that is seamless, it's much, is very user friendly, patients are going to do that more often. So, I want to end today by talking about something called patient activation. And this might be a new term for you, but patients who are more activated are more involved in their health. And really, we can say that a patient that is activated in their health care is a patient with good or strong health literacy. And so we want to make sure that we do all we can to help patients be activated in their health care. So, what is patient activation? So, Dr. Judith Hibbard and her colleagues from the University of Oregon first defined patient activation as an individual's willingness and ability to take independent actions to manage their health care. So, it means you are your own patient advocate. You are asking the right questions. You are doing the right things. You are researching your health. You are an active participant in your health. And you're doing this so that you have the best patient outcomes and the best quality of life. So, in other words, activated patients have skills, knowledge, and confidence to manage or at least become actively involved in managing their own health care. And that confidence piece is so critical. I believe so many patients are intimidated by their healthcare providers. They are afraid to ask questions, they're afraid to share and be honest. And that is something that I push constantly with everyone I know. Be open and honest with your physician, with your healthcare team. It is the only way that you're going to receive the best care possible. So, what I found was that 180 peer reviewed studies indicate these facts about patient activation. So, we're going to the research. Higher activated individuals are more likely to engage in positive health behaviors, and then they're going to have better outcomes, just as we talked about earlier. So, these patients are going to be, you know, interested in the latest healthcare findings in preventative care, in eating healthy, exercising, doing the best they can for their body and mind. We also see that higher activated patients tend to have better care experiences. So let me comment on that quickly. I do a whole session on talking to your doctor. I also do a whole session on preparing for your healthcare visit. Okay, here's what we do. When we go on vacation, we take hours and days and sometimes weeks planning everything because we want it to go so well. And what you'll probably discover is trips, vacations, things that you put a lot of thought and effort into go a little more smoothly. That should be our outlook and how we see our interactions or our visits to the physician. We should take the time to prepare. And that goes into writing down questions, writing down concerns, having information that you've looked up to share and talk with your physician about. And then when you get to the appointment, being open, being honest, telling them, here, I have these questions, I have these concerns, and then taking notes, even asking them with their permission if you can record the session. Maybe you want to go back and listen later. Sometimes in an appointment, we become so overwhelmed that we forget some of the things that the physician shared with us. And then the last step in this is a better healthcare experience is you knowing how you can follow up, how you can reach out with further questions, how you can, schedule that appointment. So when all of that takes place, you're going to have a better care experience. And then also, higher activated patients have lower healthcare costs because they're avoiding unneeded visits to the doctor, unneeded visits to the ER. They are utilizing what they have with their healthcare journey to save themselves the most money. Maybe they know about how to receive free medications from the drug companies or generic medications because they've talked with their pharmacist and their physician. So, all of that is going to help you with lower costs. And then look at this number: activated patients cost $1,987 less per patient annually than lower activated patients. That's 31% difference in cost. So it does add up, and it does make sense that when we understand our health and we're activated patients, we're going to have better health outcomes. We're going to have better experiences, lower costs, and these are the things that we all want. So, how do we measure patient activation? And I love this chart. Dr. Hibbard and her colleagues created this in 2004. And so it really does help you see the level and see where your patients are at and see where you are as a patient. Number one, you are disengaged and overwhelmed. Number two, you're becoming aware, but you're still struggling. Number three is where I find most patients. They're taking action and gaining control. They finally see, I am part of my healthcare team. In fact, patients are the most important member of the healthcare team. And then number four is our goal. This is where we want to be, and that's maintaining behaviors and pushing forward. I'm my own patient advocate. I can speak for myself. I understand my health. So, level four is where we want to end up. So, here are some characteristics of patient activation. Number one, they believe they have a role in their health. They develop knowledge and confidence in their health care. They understand how to access information and how to use it. They know how to translate what they've learned and what the physician and their healthcare team has told them into positive action. And then they maintain an active role when faced with challenges. So, when a healthcare situation comes up and you are an activated patient, a lot of that fear is not there because you're already activated. You're ready to learn what you can and come out with the best outcomes possible. So here's how we're ending. Success comes from everyone. Everyone in the healthcare process is a part of gaining improved health literacy, which will lead to more improved and positive patient outcomes. And I just need to leave you with this: communication is key. It's key in every aspect of our being, every aspect of our lives. Communication is key. But when it comes to health literacy and when it comes to patient outcomes, here are the four main communications or communication connections that I think are so critical. First is the medical provider to the patient. It is their responsibility to make sure that you understand before you leave their care. But then it's just as important for a patient to communicate to their medical provider, because if you don't share everything and you don't share the truth, they cannot give you the best care possible. And then the medical provider to the patient caregiver, and vice versa, the caregiver to the medical provider. Let me just say, as a caregiver to grandparents, my own parents, my husband, my daughter, it is just as important for me to communicate with their healthcare providers as it is for them. So make sure that line of communication is open as well. Okay, so where did I get these resources? Do not feel you have to write these down. I know this will be recorded and you can go back, but NIH, working with PubMed, the CDC, health.gov, all of these are great places to find out how to improve health literacy and how they connect with patient outcomes. So that is all for me. So I will invite Julie back and see if there are any questions that I can answer for you today.
Yes, absolutely. Thank you so much, Jessica. That was a great presentation and hit some, some new points too that I hadn't thought of. So this was great. So yeah, we do have a few questions. So one is about reaching out to pharmacists.
Mhm.
We know that they have a heavy workload, burnout, and we're wondering if, patients with lower literacy might not get, good answer by reaching out. Do you have any advice on how they might approach a pharmacist?
I do. So it does depend on where you go. Let me say that. There are so many different types of pharmacy situations that you might encounter. For most of us, we are going to go to what I call a retail chain type pharmacy, or that could be, Walgreens, that could be anything like that. Um, One of the things that I have spoken with pharmacists and they encourage, and there's really not a way to know this unless you hear this from someone, is they say that you can call and actually set up a time to meet with them. So you can actually call the pharmacy and say, I'd like a phone meeting, or I'd like to come in person and meet with a pharmacist. When is a time I can do that? That is the best way to do it, because they said if you just walk up to the counter and say, "Hi, can I speak to the pharmacist?" You're right, Julie. They might be at a time they are swamped or having to get some really critical meds out to people. So it really is important to call, or when you go in for your meds, say, "I'd really like to talk with someone." Sometimes they do have somebody available to talk to you right there on the spot, but to really get the best conversation medication and results that I think you deserve, I think it's important for them to know you're coming. The other thing you can ask of your physician is often, let's say that you're in the hospital and you've been prescribed these medications, you can also request to speak with someone from the pharmacy before you're discharged to just say, I'd like to talk with somebody about this, or even your nurse, your physician, have a conversation with them about that. But another thing you can do in the office and also in the hospital is you can request, and often the pharmacy does this, but you can request for printed out information about the drug so that you can take a look at that and, understand that a little better before you take the drug. But I would say definitely, making that appointment to go in is probably going to give you the best results.
Great. That's great advice. Thank you.
And also, Julie, I forgot this.
Mhm.
Also, make sure that you ask them to speak with someone in your native language. So, if it's better for you to speak with someone, let's say that speaks Vietnamese, Spanish, whatever that might be, you can also do that. And a lot of people don't know at the pharmacy that you can request for your labels and your information to be printed in your native language. So that is something a lot of people don't know.
That's great. That's great. Yeah, knowing your rights is always helpful, especially with
Yeah.
yeah, with languages. Okay, thank you. So another question is, how does health literacy on the patient end impact defensive medicine for the provider? So you were talking about how lower health literacy increases costs for the hospital or the healthcare center. You may have answered some of this when you were talking about patient activation, but can you just talk a little bit about how low literacy translates into higher costs?
Absolutely. So with low health literacy, I'll use the example of a patient has hypertension. They go into their local clinic, no one really explains to them what the medication is, why they're taking it. They just their reasoning, which used to be my parents but not anymore, is the doctor told me to take this. And so we're trying to get away from that. But let's say they do and they get this medication, they then begin to feel dizzy, they begin to have heart palpitations, so they automatically may call the ambulance. Then they're going into the ER, all for the ER to just say, okay, are you taking any medications? They see what it is and they say, oh, we're so sorry, these are side effects of this medication, you are fine. Maybe you need a different medication for high blood pressure, so then you're fine, but you have now the cost of the ambulance, the ER visit, the physician, costs. So all of that has piled up just because you didn't know that these were side effects from the medication you're taking. Does that make sense? Is that a good way to explain that?
Yeah,
So, and I don't say this to say if you ever think I might need an ambulance, you call an ambulance. Not to hesitate with that, but if you're taking something and let's say you start to get a little dizzy and you go, this is a side effect from the meds. Let me call my physician. I may need to change medications. And, I tell people that so many patients would say, oh, I take this medication and it makes me feel horrible. And I'd say, well, call your physician and tell them. And there's like 100 different meds for this issue. Find one that works for you. So, yeah.
great. Thank you. I think also anxiety, like if you have
Oh, yes.
low health literacy, just
Yes.
the anxiety of going in another appointment with your doctor, calling and asking a question is a lot
Yes.
harder than we might think. And so people may
Absolutely.
just say, okay, I'll just go to the ER. A
Hmm.
lot of people just sort of treat that as their general way of interacting, which
Yeah.
is, yeah,
And,
which is more common.
what we're seeing here, I don't know about where everyone else lives, is our healthcare organizations here now have what we call these standalone window. And the reasoning for that was they're trying to triage, you know, less serious situations there. Say somebody has the flu or somebody, had a concussion. Not that those aren't reasons that you need help, but that's what they're doing now to keep from like our downtown main hospitals trauma units being filled with people that don't have necessarily emergency situations.
Mhm. Yes. Yeah, absolutely. Okay, another question is what tools or initiatives are helpful to improve patient activation after a diagnosis? And we have a few more questions after this, just to give
Okay.
the
Okay.
timing.
Sure. So that is a challenge, and I'm going to be very transparent about it. The hospital system that I worked for, Orlando Health here in Orlando, actually had me as the consumer health librarian to help patients with that. But I'll give you an idea of at the time they had 7 hospitals, and I was it. I was the only person doing that. So, that's not usually the case. And the other reason they had it, not to discredit them, but they had that position because an outside foundation actually gave funding to have that position. So having a consumer health librarian or someone to help you with that information is not a requirement. And so, for patients, I think the number one thing I tell them is, asking your physician, asking your healthcare provider, what are some safe places that I can go to look up information online?
Mhm.
Where are places I can trust? So the number one that I always recommend for everybody is Medline Plus, medlineplus.org. It's the National Library of Medicine. There's not advertisements there. It's safe, and you literally punch in a topic, and it gives you credible websites that are written for patients. So I would definitely say Medline Plus.
Yeah, Medline Plus is great. Yep. And what about health coaches as a way to improve activation? What can you say about that?
I think if that is something that you have access to, that's amazing.
Mhm.
Because I think that person helps you navigate all these different aspects of the healthcare journey. So I think that's wonderful. A lot of hospitals and facilities now have health coaches or have, people designated kind of to help patients walk through that process. And I think they're seeing that once again, they invest in something like that. In the end, they're going to benefit not only for positive patient outcomes, but save them money. And,
Mhm.
let's be honest, our healthcare facilities want to make money and not lose money. So if they can see that correlation, and invest in that, I think that's important. But it is a challenge. I'm
Mhm.
just going to be honest about it. It is.
Mhm. Yeah, yeah. Um, and just one more question about patient activation. Can we measure it? Is it quantifiable? I know you had those 4 levels, so I know they did that somehow, but
Yeah.
um,
So there is a lot of research that shows, and with Dr. Hibbard's study, they had a set, um, and if you look up their research, you'll see they had a set group of questions that they would ask patients. And so that's where they gauge what stage they were in. But yes, there are tools and methods, and their tools and methods are published.
okay, great, great. I think there has also been a measured correlation between health literacy and patient
Absolutely.
activation, correct? Yeah. Okay, great. So, okay, this is another question. It's long, so I'm just gonna read it because I
Sure.
couldn't like synthesize it while we were talking. But okay, so we all agree health literacy is an issue in the U.S., but also the healthcare system is an issue. If we put responsibility for health literacy to the players and patient care administrators, physicians, and mostly patients, how do we make a change in the system? People with low health literacy need more support. So where's the government responsibility in making sure that everyone's educated, insured, and integrated and taken care of equitably? So that's a big missing piece. So what are your thoughts on that?
Okay, so my thoughts on that is that there are governmental guidelines to health literacy,
Mhm.
and the government does encourage and see the importance of it, but there's really no way to enforce that.
Mhm.
So until accreditors that accredit our hospitals and our facilities, until they make that mandatory, I don't see how that's going to actually be reality. But I think that, when you look up things and, you look at the plans that the government has for health care and that kind of thing, health literacy is now there.
Mhm.
I'm trying to think, oh, I've gone blank and I shouldn't. Um, it's, they come out with a plan like every 10 years of what is it called?
Oh, Healthy People 2020,
Thank you. I
2030.
had
Yes.
people in my brain. I was like, it's something
Yes.
people, healthy people. So the newest of that has a huge section on health literacy.
That's right. Yeah.
So that shows, yes, our medical professionals associated with the government see it as a need and important. But again, until accreditors say to hospital systems, you're not going to be accredited unless you have this type of situation set up. And some hospital systems do have health literacy departments and individuals and that kind of thing. I know recently I talked to the University of Miami, did some meeting with them, and their hospital system they're actually developing a department of health literacy because they see that need there. So it does exist, but until it's mandatory or it's mandated by those accreditors, I don't see it happening.
Yeah, yeah. I mean, I would also say that another thing the government could do is make sure everyone has health insurance. They're doing better now. The ACA has been huge.
Yes.
But also to simplify health insurance. I mean, I think that's a real tricky part, and that's something
Oh,
that the government has some control over.
absolutely. And I would tell patients constantly, and I'll say today without embarrassment, I I have struggles understanding my insurance,
Oh yeah.
and I'm a pretty educated person. I've worked in healthcare, I've been a caregiver, and I still struggle. So then I think, okay, these underserved areas, how can we even expect them to understand what they need to do? And even with our university, I just updated my healthcare for the next year, and
Mhm.
just reading all that information was overwhelming for me. So it definitely needs to be simplified.
Yeah, definitely. Yeah, and just Jessica put something in the chat about AHRPP, looking more closely at human subjects protection and clinical research. So take a look at that. But I have two more
Okay.
questions if we can try to
Okay.
squeeze these
Sure.
in. Yeah, also class standards is in the chat. Please take a look at that. That's great. So two more questions. One, how can we reconcile patient activation and self-advocacy with the biases that exist in the field? Great question. Some people will have to advocate harder for themselves until we change the organizational culture.
Oh, absolutely.
Yeah.
Absolutely. And we know, just it's funny to me, for many years, my husband was diagnosed when we were both 30. So we were young. We would go to appointments and we sat in rooms with 60 and 70-year-olds, and everyone would just stare at us. And often we were treated, I felt back then, by healthcare providers almost as children. We were kind of even talked down to because of our age. And so I think it's not only, how we're perceived by our race or our language or our socioeconomic status, but it can also be things like that. So I think it's so important for us just to continue to train our healthcare providers, and then those working in our administrative side also,
Mhm.
to really have a heart for people. I mean, I don't know if we could actually teach that to everybody, but if that's a standard for treating people with, dignity and kindness, I just think that goes so far. But it is harder for certain groups to gain that information. But again, it's your life, it's your health. I mean, you've got to fight for that harder than you do anything else. So again, I think that goes into the confidence, that
Yeah.
we've got to have that confidence going in,
Mm.
because most of the physicians that I worked with, and even our nurses, PAs, nurse practitioners, when I would say patients are terrified of you, and they would just be like, oh my God, why? And I said, because you have this status within the community, within the world, that and I said, so they're intimidated by that. And I said, so
Mhm.
you've got to make sure that you connect with them and let them know that you're a person.
Mhm. Mhm.
So I don't know if that answered it, but I just think it different groups do have to fight harder for themselves.
Absolutely, yeah. And I think, and Gertha put in a comment, I think this is more of an answer than a question, but this relates to this question. When patients know their rights, like the right to ask for a second opinion,
Absolutely.
interpreters, the right not to divulge immigration status,
Yes.
they feel more confident and less hesitant. So yeah, like
Yeah.
the confidence and knowing your rights and knowing the services
Yeah.
is
And I would piggyback on that, Julie, and say I encourage people to take someone with them. Like I encourage, especially a lot of our elderly patients, I think they struggle and they're not given the respect they need to
Mhm.
even take a friend with them, or a a child or a family member that is that bold, confident person that will help them out. Like there's no shame in asking for help and
Mhm.
having someone go with you, especially if you are new to the country or struggling with language. If you have a friend that can go with you, I think that's huge.
Yeah. Yes, great. So one more comment and then we'll stop.
Okay.
Darlene said, yeah, Darlene just mentioned training for healthcare providers to communicate in a way that all patients can understand is a big
Yes.
part of it. And I'd encourage people, I didn't get the link yet, but to look up the Universal Precautions Toolkit, which
Yes.
gives a lot of really practical suggestions for doing just that. Um, so Jessica, thank you so much. This was great. And there were a lot of questions. Thank you for you all who are participating, asking great questions. Yeah, someone says look into Teachback. Also, I just want to say we have lots of resources on the Health Literacy Solution Center about Teachback, provider training, all of the things that were brought up in this. So check that out. We've got a lot there. We have webinars every month. Please join the health literacy discussion list, the main health literacy community. We can share information there. But I want to thank you all, and you especially, Jessica, for this really personable and useful and clear presentation. Thank you so
Oh,
much.
thank you, Julie. It's been a pleasure. Honor to be even asked to come. And again, I use these resources all the time. So they are
Mhm.
wonderful.
Yeah, great. All right. Thank you so much.
Okay.
Bye, everyone. Thanks for coming.
Bye. Thanks.